Everyone, it's Hunter Hicks. Today we're going to look at some common STIs and their treatment. So gonorrhea, a very common STI we see. As far as symptoms, often asymptomatic in our women until it really spreads to more of the reproductive tract. Now, some things they can have is vaginal discharge, painful urination, abnormal menses, dysmenorrhea or painful menses, painful intercourse, and pelvic pain. As far as men, they can have painful urination, purulent discharge, urethra itching, and most resolve spontaneously, but that does not mean they're still not infected and they can't give it to other people. Now, some complications to gonorrhea in men are going to be things like prostatitis, epididymitis, and urethral stricture. In women, commonly to cause pelvic inflammatory disease, which pelvic inflammatory disease can arise when patients come to us with pain. Sometimes that pain is in the abdomen and the peritoneal area that is worse with activity like walking or intercourse. It can also give us like chills, fever, nausea, pain. We know that gonorrhea can increase risk for infertility by scarring the fallopian tubes, much like chlamydia, which we'll cover as well. But we know pelvic inflammatory disease might increase our risk for infertility and ectopic pregnancy. Now, gonorrhea has pretty high resistance. A lot of times what we're going to do is give ceftriaxone or a cephalosporin IM, and then azithromycin, which is a macrolide PO. We know macrolides may cause some GI upset, so keep that in mind. When we look at syphilis, 91% of our newer cases these days are going to be found in males. We have three kind of symptoms we're going to see. Primary is going to be just a sore. Secondary is going to get more of the systemic skin rashes, and then systemic effects like fever, malaise, and then tertiary, it can actually start to destroy the skin, bone, and soft tissue. Now, treatment for syphilis is going to be penicillin G, which you know is a narrow spectrum portion of penicillin. Chlamydia is the number one STD we're going to see. Now, chlamydia, as far as signs and symptoms, 90% of people are asymptomatic, which is pretty scary. Now, men can have clear discharge, burning on urination. Some of the complications, same as we saw with gonorrhea, like urethritis and epididymitis. But you know, epididymitis will sometimes present as scrotal swelling or scrotal pain. Urethritis would be like painful urination or you're itching around that area. Women can have acute urethral syndrome, which is like painful urination with urinary frequency and then a sterile pus in the urine. Infertility risk, much like gonorrhea, but this is due to the infection actually damaging or scarring the fallopian tubes. Chlamydia and gonorrhea are common causes of pelvic inflammatory disease, which we know can lead to ectopic pregnancy. As far as treatment, as we can see, we have azithromycin, so another macrolide, and doxycycline, which is a tetracycline. When we look at the next one, trick, we know this is the most common non-viral STDs. Now, again, asymptomatic up to 85% of people. Now, men, more likely to be asymptomatic. They might have some painful urination or itching. Women can have yellow, green, and malodorous discharge, burning, itching, and some painful intercourse. Now, treatment can be flagell as well here. And last but not least, bacterial vaginosis. Now, bacterial vaginosis itself isn't quite just an STD. It is really commonly to see an imbalance of the micro or the normal flora of the vagina, and then maybe some overgrowth by a numerous amount of usually anaerobic bacteria. Now, some of the criteria we can look at here is the Amsel criteria, which will look at the presence of gray or white vaginal discharge, a vaginal pH greater than 4.5, a positive fishy odor, and the presence of an alkali product like potassium chloride. We call this the whiff test, and then the presence of clusa, which are bacteria that look like they have pepper shaking on them because they're covered in, these are going to be epithelial cells of the vagina that look like they have pepper on them because they're covered with bacteria. Treatment is going to be flagell and clindamycin cream. Down and dirty on those, much more to cover, but I thought we'd jump into them. If you have any questions, leave a comment. If you liked it, give me a like, and I'll see you next time.